every single month, we have multiple parents bringing their kids in, and the story is the same. You know what, Dr. Bhattacharya? My son keeps falling sick all the time. He snores. His mouth is always open. I don't feel like he's sleeping well. He keeps moving, tossing and turning in his bed. And he gets tired earlier. He's not focusing on his studies. I've been giving him some medicines. I've been seeing the pediatrician. And finally, someone has told me that it could be adenoids. Do you think these are adenoids? What exactly are adenoids? And the parents are usually extremely nervous because they've Googled and they're kind of convinced that their son needs a surgery and it's risky and all these things. And so when they come in, we first sit down and tell them, don't panic. Let's break down what adenoids are, and let me see if we can help keep your son out of the operating room or help him get back his normal childhood. So today, that's what we're doing. We're pretending that you are here because somebody that you know may be having adenoids, and you're worried about adenoids, you're worried about all the information that you're getting. And as a doctor, we will help you understand everything about adenoids with no jargons, no confusing words, just plain, simple, basic science. Let's get to it.
Namaskar. We are Dr. Bhattacharya ENT. So, the first thing that we talk to about is what exactly are adenoids? Now, the adenoids are just like your tonsils. So, if you look at this picture, you will see that you have the two big tonsils in the back of your throat. Almost everybody knows what their tonsils are. What you don't know is that there are actually not two, but three tonsils. They make a triangle like this. So the tonsils sit at the back of the throat, whereas the adenoid sits at the back of the nose. And these three together form a part of a structure called the Walde's ring. This is actually a set of lymph tissues, which are basically the police station of your body. So when your kid is eating food or when they're breathing, these areas, these tissues, they catch the dust, they catch the bacteria that are living in our environment, and they teach our body how to fight these particular infections. That is why when we have Golgappe, we don't have any problems, but someone from the US comes in, has a Golgappe, and spends the next 3 days in the bathroom. The adenoids are tissues whose job is to teach your child how to fight all the normal infections in the environment. But it is only a small part of the overall tissues. Research shows that even if you remove the adenoids, you're basically removing only 10% of the tissues. So the first and foremost thing is that, is the adenoid something that is important and helpful to us? Yes. But is it absolutely essential? That means that we cannot live without it? Absolutely no. So what happens is that as your child is growing, whenever we breathe, we're breathing in dust and we're breathing in bacteria. And these dust and bacteria get dissolved in the mucus inside our nose, and then they throw back into the throat. As they're going into the throat, the adenoid tissues are sitting like vultures, and they will scoop up some of these dust particles and these bacteria, and they will kill them and teach the body how to fight it. Adenoids are normal in children. Up to the age of 14 years of age, we see adenoids in almost every child if we do an X-ray. So just because a child has adenoids is not at all something to be concerned about. Adenoids are normal. Every child has some amount of adenoids, and for almost every child, the adenoids will go down as they get older. Now let's talk about what is the problem with adenoids. Now see, as the adenoids eat up some of these infections, they kill them, and then they teach your body how to fight these infections. The problem happens when some of these infections get very, very strong. When these infections get very strong, your body cannot kill them. So your body creates small jail cells like micro abscesses and holds these bacteria as captive inside the adenoids. Now, these bacteria try to breed and they try to increase in size. This causes the adenoids, the body's tissues, to proliferate, that means multiply, and make bigger and stronger walls of the jail. This leads to the increase in the size of the adenoids. But if the bacteria are very strong, what happens is they cannot be killed. So after a point of time, they break through and they cause an infection. Once the infection happens, your body starts fighting it. We give some antibiotics, the bacteria come in control. But the adenoid tissues, they try to create a stronger barrier around it, and thus they grow larger in size. The next infection causes them to grow even larger in size. And this is what eventually leads to the problems that we see in the children who are sent to the ENT doctor being told that they have adenoid problems. So now that you know what is the adenoids, let's go and understand what are the problems that the adenoids can cause. So as you can understand, the major problems occur with adenoids for two reasons. One is the size of the adenoids, and two is the fact that these infections are actually hiding inside the adenoids. That means that your child is carrying these infections around like a kangaroo. They're not coming from outside. So let's talk about both of them. The first problem that we see children fall with adenoids is that they are falling sick very frequently. Now, we don't want our children to fall sick a few times every year. Remember, all modern studies show that falling sick a few times in a year while their immune system is developing is very, very important because it helps build the child's immunity. In fact, that is the reason why we do not give antibiotics to a child until 48 hours of an infection, because we want to give the body the time to learn to fight it. However, if your child is getting infections so frequently that their body is not able to recover before the next one hits, over a period of time, it depletes your immune cells. That means it's like a war. Your soldiers are getting killed off. If your war is going on for a short time, that is great. Your soldiers learn to practice in real world situations. But if you have a war like the Ukraine war, for example, going on for a long time, you've run through your soldiers. Now you need normal people coming in to fight. That's exactly what happens in this case, that your immune system actually progressively gets weaker. Your immunity is not getting stronger, it is getting poorer. This increases the risk of long-term infections and increases the risk of immune issues in the future, like sinusitis, autoimmune problems, etc. Now, when a child gets more than 6 infections in 1 year, that is within a period of 6 to 12 months, where the child has needed antibiotics, that is our point of time to worry about it. Up to 3, 4 is okay. But if it is more than 6, that means every 6 to 8 weeks your child is falling sick, then we need to help him. Because if we do not help this child, what will happen is A, their immunity is not getting the chance to get stronger. B, is that because all the body's energy is being spent in fighting these infections, your child is actually not having energy left behind to grow. These children will not gain weight, these children will not gain height, and they are found to have multiple microvitamin and micronutrient deficiencies. So if these infections are happening, that is one of the times when we should be concerned. The second way that we look at adenoids causing us issues is because of the size. The adenoids are sitting right in the back of the nose, as you can see here. Now, that means that when we are breathing air, the air has to go through this area. Now, if I have a very big narrowing over at this point, then what happens is that there's a restriction to the airflow. This means the child is struggling to get oxygen in by a very small passage. Think of it like trying to have a milkshake with a very thin straw. You have to create a lot of suction pressure to try to get the air in. So much suction that sometimes you make the straw collapse on itself, which is what happens in these children. This is called pediatric sleep disordered breathing or pediatric sleep apnea. Now, pediatric sleep apnea is a major concern. The reason is because when you're an adult, your brain has already finished growing in volume or size. We can make new neural connections, but our size of your brain is finished. But at a child's age, until they get to around 14 years of age, their brain is physically growing in size. Now, this growth happens during sleep. What has been found is that if a child is getting poor sleep, not for 1 day or 1 week or 2 weeks, but for months at a stretch, the brain development or the growth of the brain doesn't happen as well as if we want it to. Think of it like a plant. If you don't water a plant 1 day, it's not a big deal. But if you don't water a plant every day, most likely it's not going to reach the size that you expect it to reach. So, these two are situations where we worry. That means number 1, it's more than 6 infections needing antibiotics in 6 to 12 months. Or number 2, your child is having poor sleep quality because of obstructive reasons for more than 3 months, which has failed nose sprays, etc. If these two things come into picture, if both of these qualities are there, then that child needs to be treated. If these things are not there, your child has had 2 colds and the doctor has got an x-ray and it comes out as adenoids are there in the x-rays, and after 15 days your child is back to normal, do not worry at all. You do not need any treatment. The adenoid x-ray, if it is got when a child has got a cold, will always show enlarged adenoids. It does not mean that your child needs a surgery. If the adenoid x-ray shows enlarged adenoids with these 2 reasons and the child has failed medical therapy, those are the children that we need to see for treatment. So every month I see at least 10 to 15 parents who come to us having been told that their child needs a surgery, and when we ask them, they have an x-ray which was gotten when the child had a cold. So adenoid x-rays during cold have no value. We need the adenoid x-ray when the child does not have a cold. That is where the money is. Before we go into the treatment options, let us go over a couple of things again. We already talked about the infection-related issues and the sleep-related issues. The other ways that I see children coming into the clinic sometimes is when the dental doctor has referred a child because the child has had poor dental issues and they need to be put on braces. And that is one reason for which the dental doctor will send us, because even if you put braces and bring the teeth back into alignment, if the nasal pathway is not open, once you take off the braces, because of the continuous mouth breathing and the pushing of the tongue against the teeth when they're swallowing, because the throat gets dry because they're breathing through the mouth, the braces will fail. So that would be one other way that we see children in. The fourth thing that we can sometimes see is when children are developing a kind of phase called adenoid phase, in which because of long-term poor breathing, these children are developing a situation where the cheek sinuses are not growing. These would be other conditions, but remember, none of these will happen without your child having mouth breathing and without your child having snoring and without your child having more infections. So if either of these 3 things are not there, not a single child can go and suddenly develop adenoid phase problem without any of these indications. So if your child is not having any of these indications, can your child suddenly develop this? That is not true. These will be there because these signs show up much earlier than the phase change sign. So now that we talked about this part, let's talk about the treatment options. So when parents bring their kids in, the first thing that we look at, what is the state? Is the adenoid inflamed? Is the adenoid non-inflamed? Usually the first step we like to do is use a small nasal endoscope to look inside the nose of the child. When we go inside the nose of the child, we can see whether the adenoids are swollen or they are inflamed right now. If they are inflamed, then we prefer to give some medications, some nose sprays, etc. and try for a period of 15 to 20 days and see if it reduces. If it does reduce, that's fantastic. If it doesn't reduce and if it is very enlarged and they are having all of these other issues for a given period of time, then we sometimes talk about removing the adenoids. We'll get into the removal of the adenoid part after this, but the removal of the adenoids does not always mean that we have to remove the tonsils. This is another common question that we get from parents. This is a very old concept because previously as doctors we used to think that the adenoids, if you remove them, the tonsils will grow in size. That is not true. Now we know that the reason that used to happen is because we did not have the technology to remove these adenoids completely. So now, if the tonsils are not catching infections, if they don't have micro abscesses inside the tonsils, that means the tonsils are not very enlarged, they are not pockmarked, they are not showing signs of these chronic tonsil issues, we do not remove the tonsils. And that is a huge benefit to the child if we don't have to remove the tonsils, which we will get into later. The other things that we sometimes recommend people to do is if the child has severe allergic issue, sometimes we talk about doing a little bit of immunotherapy, which could help reduce these adenoid swellings. If the immunotherapies, the nasal sprays, the medication courses, which may sometimes include antibiotics, anti-inflammatories, short courses of steroids, but in judicious use, that means we don't want to keep pumping these powerful medicines into your child. If these work, well and good. If not, then unfortunately we go ahead and talk about removing the adenoids. And that is what we're going to talk about. That is where most of the confusion and the questions come in. So we're going to break it down for you in the next section. So one of the things that as doctors is difficult and takes learning is to tell a parent, madam, I think your son or I think your daughter is going to need the adenoids to be removed. And it's completely understandable because I've been on both sides of the table, and it is one of the hardest things to think of your kid going through a surgery. So when we talk about adenoids, the first thing you need to understand is that as doctors, the point where I'm talking about removing adenoids, and that is true for almost every good doctor who are following guidelines, is a situation where we would put our own children through the adenoid removal. The reason is because these adenoids will, yes, they will automatically reduce by the time your child is 16. But in a case where the previous conditions are met, not doing the adenoid is going to cause issues to the child which will last for the rest of their life. That means that if the brain development doesn't happen where it should be, the child will never be able to achieve their full intellectual benefit. If these things are not sorted early, many of these children will run into attention deficit hyperactivity disorder. So they run into behavioral problems. Once behavioral problems develop, again, behavioral problems are developing here because of chronic poor sleep and sleep deprivation, because of chronic poor oxygenation. When these developmental problems happen, then after removing this, you need to go in, do therapy. So there are a lot of long-term impacts that can happen to the child. These children can very often be very good students when they're young, but as they grow up, they start falling behind in their studies. And unfortunately, many times, people think that it's because the child is naughty or shararati or badmash. It's not. It's just that your child is not being able to keep up with the increasing demands of the study because his brain maturity is not able to keep up. So these are things that are time sensitive. Yes, he will get better by 16, but what we have lost in this golden period, we cannot get back. So if your child is matching this criteria, then yes, if it is my child, I will 100 times go through with the adenoid removal. The first thing about adenoid removal is it necessary? And the answer is that if the previous things have failed and your child is matching this criteria, then yes, it is going to absolutely change his or her life. We don't want to do a surgery for a child where we can avoid. But the opposite is also true. We don't want to not do a surgery for a child which will make him suffer for the rest of his life. Now, the second thing that parents ask us is, how risky is it? Does it come back? I have heard that it comes back. And this is where the big changes happened in the world. 15 years back, we did not have the technology to remove the adenoids completely. Adenoids are a tissue. It's like a finger. If you cut off a finger, your finger is never going to regrow unless you're a salamander. So it's the same way. If you have removed the entire adenoids, the adenoids can never ever come back. The problem is the adenoids are located in a C shape. So they go in a C shape all the way to the side of the ear tubes, all the way to the back. Now previously as doctors, we used to remove the adenoids blindly by shaving it through the mouth, in which case we could only remove the middle part of the C. Now if you have left behind the two sides of the C, obviously after some time these tissues will swell and regrow and they will come and go back to the center. The reason why doctors were scared of going to the sides is because behind these ear tubes, some important blood vessels are there. So doctors used to be scared, with good reason, of going in there and causing trauma to these blood vessels and causing bleeding. Now, however, the technology is completely changed. We have plasma-based technologies which can melt the adenoids. Because the adenoids can be melted and they can be sucked in, there is no risk of bleeding in adenoid surgeries because you cannot injure the blood vessel without physically going and touching and cutting into the blood vessel, because the tissue pushes the blood vessel away and it dissolves out the adenoid tissue. So because we have got this new technology, the doctor can feel much more confident in going ahead and removing out this entire C. Here you can see a small video of how the adenoids look for a normal child and how they look after we have removed them completely with the surgery. And you can see here that when we have removed them all the way from behind the ear tubes into the back, it has been completely removed. So when an adenoid has been removed in the correct way in today's day and age, the chance of the adenoids coming back is zero. The chance of bleeding is zero. The chance of any other major problem for the child with the modern technology is zero. And the big benefit of not having to remove tonsils is that these adenoid removals, because we don't have bleeding risks, they don't require any preoperative blood tests for the child. You can basically bring your child into the hospital, the doctor checks the child, we take them into the operating room, We put them under anesthesia. Once they're under anesthesia, the doctor will put a small IV channel and they will start their anesthesia medications, and that is how we do these surgeries. This technique is followed internationally across many pediatric ENT centers, and it is a very successful technique with zero needle sticks to the child. The benefit of these adenoid removals without tonsils is that the adenoid removal surgery is totally painless. That means that your child comes in today morning, and by the time you take them home, either in the evening or next morning, depending on your requirements, your child goes home pretty much like how they walked into the hospital. There is no pain in this. There is no dressings. There is nothing that precludes our child from going back to normal life. If I have to remove the tonsils, however, even with the modern intercapsular techniques, the child will have to be on soft food for a few days. That is the reason why we try to avoid tonsil removals unless it is playing a role in your child's problem, because adenoid removal by itself, completely painless, healing is very fast. And tonsil removal along with adenoids makes it a little bit more healing-wise, a little bit more intensive. For 5 days, your child has to take some medicines, they have to be on a little bit soft foods. If that tonsil removal is required, then 100% it is worth it. But if it is not enlarged, we do not remove it, and the guidelines do not recommend removing tonsils as a routine. Now, once your child goes home, we give you some nose sprays, you'll be cleaning the nose, maybe a little bit of antibiotics depending on the doctor's preference. And as we do that after a period of time, 1 week, we see the child back. Most of the times the snoring goes away immediately. But on the 3rd or 4th day, a little bit of snoring will come back. That is normal because the nose will swell. After 1 week, when the doctor has seen the child and we do a small cleaning, that is when we really start seeing the big improvements of this. We do these surgeries very frequently, and most good ENTs do these surgeries frequently. And doctors who are following the correct techniques, following the current guidelines, this is one of the surgeries which we love to do. The reason is because it's very unusual that you've done an adenoid surgery and you have to tell the parents that, okay, this surgery was successful. Usually it's the parents who come back and say, sir, it's completely changed his life. He's sleeping beautifully. I mean, we can see a total difference in his quality of life, and which makes it very rewarding as doctors to be able to make that change for a child and to be able to see that happiness in the parents' eyes. So when we sum up these situations, the first thing that I would say is that if your child has adenoids, do not panic. Not every child with adenoid enlargement on an X-ray needs surgery. If I see 10 patients coming into my clinic who have been told they need an adenoid surgery, I eventually need to end up operating 3 or 4 of them. The remaining 6 of them are children we can keep out of the operating room. Now that you have the information, if you feel that your child is here, or if your child has been told that he has adenoids, don't panic. You know the information, go into the doctor's clinic, discuss with your doctor. Make sure you pick a doctor who is dealing with these children very frequently, because these doctors need to be very confident in the anatomy, very confident in using these newer equipment so that we can get great results for children. But I will assure you on this one that adenoid removal surgeries are some of the most safe, the most successful, and least intensive and healing time requirement surgeries inside of the entire book of ENT surgeries that we do in today's day. I hope this talk helped you. If you would like to connect with us, or if you have any questions, feel free to reach out to me or my team. We'd be happy to help you. Otherwise, if you know someone who you feel may be helped by seeing this, please share it forward. I look forward to connecting with you guys again with another video. As of now, I'll be taking my leave. This is Dr. Bhattacharya. Thank you. Have a great day and see you soon. Namaskar.